Good news you can use with Deb Mahone, yeah. She got the good news you can use. Good news you can use for your life.
Hello, my name is Beverly Mahone, and I'd like to thank you for tuning in to another edition of Racism in America. Since July of last year, a group of panelists from around the country and I have been talking about the issues we've been facing. Ever since the George Floyd incident, we've come together to see how we, as individuals, can try to make a difference in our communities. Well, a lot of things have happened over a year, and we've all been dealing with the pandemic. And today we are going to talk about the vaccine, the vaccinations, and answer any questions that anyone may have as it relates to getting vaccinated. Now, if you tuned in earlier this week, you would have heard President Joe Biden say that by May 1st, he wanted up to 1 million eligible adults to be vaccinated. I believe that's how he said it. So he was hopeful that by July 1st, July 4th, we'd be able to get together, hug our friends and family, and go about business as semi usual. Today, I have an esteemed panel along with a very special guest, Mr. Cornell Wright, who is the executive director for Minority Health with the North Carolina Department of Health and Human Services, who is going to update us on what's going on with the vaccine. But before we get started, let's just everyone introduce yourselves, where you're from, and then we'll keep going. Let's start with you, Daryl.
I'm Daryl Moss from Creedmoor, North Carolina. Glad to be here and thank you for the invitation.
Very good. Brooks?
Sorry about that. Hey, Kalamai. My name is Brooks Bays. I live in Honolulu. I have for 40 years, and my family's from Texas, though.
Tasha?
Good afternoon. My name is Natasha Peterson, originally from St. Croix, U.S. Virgin Islands, but live here in North Carolina.
Gary?
Oh, good afternoon, everybody. My name is Gary Jones. I live in Philadelphia. I am originally from Goldsboro, North Carolina, but I'm here in Philly.
Dorothea?
Hi, I'm Dorothea Kemp, and I'm in the Detroit, Michigan area, originally from Phoenix, Arizona, but I've been most of my life here in Michigan.
And last but not least, or next to last but not least, is Vicki.
Hi, I'm Vicki Nui. I'm a writer in Chicago. I've lived here most of my life. I grew up in St. Louis.
And now, last but certainly not least, is the person headlining this call today is Mr. Cornell Wright. Thank you so much for joining us. Cornell, can you share a little bit about your background with us?
Sure. Cornell Wright, Executive Director of the North Carolina Office of Minority Health and Health Disparities out of the Department of Health and Human Services, where Dr. Mandy Cohen is our secretary and Mr. Ben Money serves as our Deputy Secretary for Health. I am a native North Carolinian and a husband and father of one, and I am a two-time graduate of North Carolina Central University, go Eagles, and that is where I was trained under the tutelage of the Beverly Mahone.
Okay, I'll take that credit. Okay. And I think I've trained you well because you've gone on and just become such a success. Anyway, all right, so let's just go ahead and get started here. So Cornell, where are we with the vaccine? We've heard all kinds of different stories. We were in group A, B, C, or D, and then some people moved up from D to, or 4, excuse me, 1, 2, 3, and 4. Some people seem like they moved up from 4 to 1. What's going on with that?
So as you know, everything is fluid. We're providing guidance to people in the state of North Carolina, but we're also feeding off guidance that we're getting from the federal government, being CDC and the Federal Health and Human Services, and the president's desk as well. So a lot of things are ramping up. Guidances are changing almost daily or multiple times a day, it seems like. And so we're trying to really adjust on the fly on some of these items because it's happening so rapidly. And so now we are opening up group 4 a little bit earlier than we anticipated. We just opened up group 3. So one thing to know in North Carolina is that any door that opens stays open. So if you are in group 1, 2, or 3, you're still eligible to go get vaccinated. And it's just really been an amazing journey to see all of this kind of play out, because you have a big FEMA site in Greensboro, North Carolina right now. And Greensboro, for people who may not be familiar with the state or haven't been here in a while, it's pretty much the middle of the state. And so it's almost, at the greatest points, 2 hours from everything for the most part, or 2 or 3 hours at most. And so being in the middle of the state, it was awesome that there's this FEMA site set up at the Four Seasons Mall area where they're doing drive-in and walk-in appointments. And what was so significant about that is the federal allocation of vaccine is not up against what the states get normally. So this is an add-on to what the states are getting allocated, in our normal allocations that we send out to health agencies, local health departments, and other providers in communities. So this is in addition to, which is a great thing because it doesn't count against our normal state count, which was amazing to have extra resources added in, because there's so much work to be done, and there's so many people who are still on waiting lists to get vaccinated. And so this is opening up some more opportunities to people to get vaccinated.
So let's talk about people moving, up the ladder, so to speak. What credentials do you need? Like if I'm in group 4 and I know I'm in group 4 because I've been told that, but and I'm, thinking, well, maybe I can go and try to get a shot now, even though they haven't opened up group number 4. What credentials are you looking for to prove or disprove that I'm not in the other 3 groups?
So there are really no, and I'm gonna say this with a caveat, there's really no kind of documentation that you're gonna need to take with you. In some areas, they may ask for some ID, and it really depends on who the provider is. So if you're going to like a federally qualified health center or someone who may be getting allocations from the federal government, they may ask for ID. Normally, the guidance has been from the state that we're not requiring ID for people. I know there are some federal kind of connections where they have to do that as a part of protocol. But for the state, we're not saying that people need to require ID. And so with that said, usually there's like a couple screening questions that are asked when you're scheduling your appointment. And then people are using those screening questions to determine if you're eligible or not. And they'll let you know when you call up. Now, it also depends. So Beverly, I know I just sent you some information about an event that's happening on the 18th. But let's see, 14, 15, 16, 17. Yeah, the first prioritization of group 4 starts on Wednesday on the 17th. So you can actually schedule an appointment that's for the 18th if you meet criteria between groups 1, 2, 3, and prioritization of group 4. So if you call today and you fit into one of those criteria areas, you could already schedule your appointment, because by the time they open up prioritizations for group 4, your appointment would be the next day. So you can schedule appointments ahead of the actual date of when your slot opens up. But if it's after the date after it opens up, you're still fine because you're just scheduling your appointment.
Let me ask this question. A friend of mine said she was getting her vaccine today because she has a disabled child, and the child is eligible. So that made the family eligible. Is that the rule?
So I don't know if rule is the right word, but that's been some of the executed practices that we have seen.
Okay, so if you have somebody in your home who has a disability and they're in group 1, but you're not in group 1, you're in another group, you can still be vaccinated because of them.
So again, it's what we've been seeing, even in group 2, where it was 65 plus age individuals. We saw that some people were caretakers and maybe had to bring somebody to a vaccination site or to an appointment to stop spread. We have seen some providers also vaccinating the caregivers.
What extra steps are you all taking to make sure that those communities, the underserved communities, are being served? Because you hear so many horrible stories about, people who are jumping the line and going into communities that they otherwise wouldn't go into to get the vaccine. So what's the state of North Carolina doing?
So, great question. So what we're doing is we've really moved our efforts to really put equity at the front of our responses. In the original administration that started off with vaccine, there was a huge emphasis on speed, but that wasn't as equitable as we needed to be. So now we're looking at the numbers and looking at the data internally to our state and saying, okay, how can we better reach communities of color or our historically marginalized populations and get vaccine in those communities? And so what we've been doing is doing some extra equity allocations of vaccines in certain communities, and we're calling them equity bumps. So certain communities may have higher populations of historically marginalized populations or minority and underserved populations, or people more at risk or more vulnerable that also fit into the criteria of the groups that are open. And so what we've been doing is trying to put more vaccine doses into those communities so it can actually reach the communities, and then partnering with not just the provider, but also community-based organizations to make sure that people of that community are connected to getting vaccinated and getting the appointment scheduled, and going to different things like, Your Spot, Your Shot.nc.gov to really see where the resources are, what people are asking, and then sharing where you can go get vaccinated at different plots of North Carolina and different areas that may be close to you.
All right, so by a show of hands here with the panel, how many of you have already gotten at least one shot? Okay, so Natasha and Dorothea and I have not. All right, so let's start with Natasha. Is it because you're in group 4 that you haven't gotten your shot?
Well, so let's start there. I'm not as informed as I thought I was because I don't know what the groups are. And I did have one main question that I did heard about was with people with allergies. And I'm not talking about just like regular seasonal allergies, but that use the EpiPen. I was told that it wasn't enough testing for those people to even take the vaccine, specifically for shellfish allergies, where you would definitely, your throat would close up. So that was one of my main questions that I had for the vaccine.
Can you address that, Cornell?
So even often mistaken as a doctor, I am not a doctor.
Right.
And I am not, able to give medical advice, but I think you're on the right track of wanting to understand what those nuances are for your personal situation. And I think it's a good route to go and speak to a medical professional, just because you don't want to do more harm than good. And
Right.
so I think that is an excellent point that a lot of people need to take. And I love the fact that you said that you're not as informed as you want to be, because that's what these outreach efforts we've also been doing. I know Bev asked me what the state is doing outside of putting vaccine in the right places and with the right people. We've also been doing these vaccine kind of outreach activities, such as something like this, doing panels, doing town halls, talking to people so that we can gather questions like that and be able to come back and share the answers that we've understood and received from medical personnel to really get to the root of some of the questions that communities are having. And so, long and short of it, I don't know the answer to that one, but it is always good to have that consultation with your medical provider or a medical team before you do any kind of decision with your health and well-being. So I really appreciate that sentiment.
Do you have another question, Natasha?
Not at this time. No, I'm good now.
And I was very surprised that you didn't know about the different groups.
Well, let's go back to that too. I wasn't in the bracket where I was even considering the vaccine, and that could be why. So at the beginning, I wasn't even considering it, so there was no need for me to be informed. I wasn't take it. So now, I'm thinking about it. I'm contemplating it, but it was my shellfish allergies because I was hearing all the different things that kind of held back from it. My mom and my brother has taken their first shots. So I'm being open to it now, but that's the reason why I didn't know much about the groups.
Okay. Now, Vicki, you put something in the chat that might help Natasha. Can you explain that a little bit?
Oh, sure. I have a number of allergies that can create an anaphylactic reaction, drugs and food. I've been in emergency rooms in 6 different states from anaphylactic reactions. So I absolutely respect what you just said, and I understand it. When I talked to my doctors in January about the vaccine, they said, yeah, no, you're not getting it yet. You need to wait and see what's going on. So last month, about a month ago, I contacted the primary care doctor again, and I said, has anything changed? Because my husband just got his first dose. And she said, yes, you can get it, but only under certain conditions. First of all, you're not going to the grocery store. You're not going to the parking lot at the United Center. You're not going to Walgreens to get your vaccine. You are going to the hospital to get it there. And so, the hospital she's connected to, So when your MyChart account sends you an email and says, you can make an appointment now because you're in group 2, make it. She said, now when you go, you tell them that you have a history of anaphylaxis and that I told you you need to wait 30 minutes afterwards in the observation room, not 10 minutes like everybody else. And so that's what I did. I got my first dose last Friday. I was nervous. I'm not going to lie. I was very nervous about this. But I wanted to do it. It was, if it was possible. And I knew, like pretty quickly, like within half an hour, I would know if there was a problem. So I actually stayed 40 minutes, probably because there were 2 other women in the observation room who had to have their blood pressure checked. And I thought that made me a little nervous. So that's why I stayed a little bit extra time. But having said that, it's the second dose where you're more likely to have a serious reaction. I'm already scheduled for my second dose at the hospital. And, I carry an EpiPen all the time. So it's not like I wouldn't have it with me if I got it somewhere else. But she was just concerned that, certainly for my comfort level too, but also for the care I would get if there was a problem, that I was in the best possible place. So that would be my recommendation, to discuss with your doctor, because if that's an option, I would jump on it, because that's where you're going to get the best attention if there's a problem.
Very good.
Thank you so much for sharing.
That. Yes, absolutely. All right, Dorothea, you haven't not yet. Why not?
Actually, I just became eligible like last week. I did receive an invitation from my doctor, but prior to that, in February, I had a checkup and my doctor and I discussed it. And, you know, I have a few pre-existing conditions. And so her advice too was to get it there at the clinic and not at one of the drive-through or walk-through centers. So, you know, when I became eligible, she sent me the invitation. I just haven't scheduled it yet. And that's mostly because they're trying to get the teachers in right now. And I'm like not trying to bump a teacher because I'm in a situation where I don't have to engage with the public that much. So if the teachers can get in and get situated before they start teaching the kids again, then I feel like they're a higher priority than I am. And that's just because I've been, you know, really, really good about isolating, wearing my mask, using my sanitizer, all of that. And so, you know, it's something that I plan to do. I just am not pushing myself forward that fast in line because there are people that I feel have a higher priority than myself. And like I said, I just became eligible last week, so.
Okay. Do you have a question for Cornell?
No, not really. I've just been kind of following the trends. If I have the opportunity, my preference is to get the Johnson & Johnson. And that's not because I feel like they're better or worse than anybody else, but I'm like really bad about going back for seconds of stuff. And I feel like if I can get the one shot, you know, that'll be better for me because then I don't have to go at the last minute. Oh gosh, I'm supposed to get my second. Yeah. So, you know, just knowing how I tend to do things, like, you know, if I do something, I like to check it off my list and kind of be done with it and not have to keep going back because it just doesn't work out for me sometimes. I'm kind of busy. I have to check on both my parents all the time to keep up with their health. And fortunately, neither one of them has gotten sick. You know, we've done a real good job of keeping them
Knock on
safe.
wood. Yep, let's do that. Knock on wood.
And actually, my mother got her first shot last week. So we're moving right along here.
Very good. Now, Cornell, let me ask this question because Vicki brought up a really good point here. It's like, it seems like everybody is opening their doors so you can go get a shot. And I am leery about going in a parking lot of some, you know, the PNC arena or the fairgrounds where, you know, you've got like thousands of people lined up and they're all getting this shot. And now they're saying that like they're training all these people to be able to give you a shot. So and if it's not my primary caregiver and it's just somebody that is at the state fairgrounds, how do I really know? I mean, that's a fear. How would I really know?
So the people that are getting trained to do vaccinations are going through some really good trainings. They're really trusted sources that are viable in our community. So let me lessen your fear. It's nothing that's fly by night. It's not a snake oil salesman or anything like. These people are trained professionals to do their jobs, and I understand the fear of just the unknown. But these people are really good at what they do. They're training, continuously as things change with us or, with guidances, they're the first to really, be able to implement it in our community. So great question, to make sure that you're going to be safe. And this is why we have these conversations. But yeah, the people that are administering vaccine, they know what they're doing. They can do it in a way that sometimes people are saying they didn't even feel it. And that's amazing. And I know I've been in medical situations where I had to get shots, and the different techniques make a difference, because there are some techniques that people can do and you don't feel a thing. And there's other techniques that people do, and you feel every bit of it. And so that touch does make a difference. And then there are some people who are so good at what they do, like they can get you engaged or laughing or in the conversation, and they're done, and you didn't even know it.
Okay. Okay. Well, I'm planning to go through my primary care physician because I need to be cleared to do
Right.
it. So I need to hear. So Daryl, you said you had some information for Cornell, but you also got the shot. So take us through your process. What was that like? Did you just go to your doctor? Did you go to the Walgreens? What did you do?
Well, that's I actually registered on Duke My Chart and through the state's website, and my thought process was whichever one comes through first, that's where I'm going. So and it worked out. My Duke My Chart came, so I went over to Duke and got shot one, and I'll get shot two this coming Sunday, not tomorrow, but a week from tomorrow. So it was pretty painless actually.
Did you
The
have any
process.
hesitation at all in the
No.
beginning?
Nope. I was looking forward to getting it. I knew all along that I would. And I had the good fortune of being able to assist my mother with getting her shot. She had signed up on Duke My Chart, and I took her to get her 2 shots. So she's actually passed I guess what you would call the 10-day period, and so she's pretty much good to go right now.
Okay. Now, what's this rural access that you wanted to share?
Well, I wanted to just, and I know this is information that Cornell and his team is probably getting on a day-to-day basis. But, and Beverly, I was mayor of Creedmoor, and we're in a rural community out in Granville County. And the thing that I wanted to share with Cornell is that, a lot of folks out our way don't have internet access. So as a community, we've had to put in some really old-fashioned kind of ways of getting the word out, basically going door to door, making phone calls, those kinds of things. And so I did want to give, some props to the Vance Granville Health Department, Lisa Harrison and her team, and Granville County Senior Services. They literally have been on the phone calling people, and then they will say, well, if you know someone who needs a shot, let us know. And they have worked hand in hand with the community to help folks get shots. And so when I talk about rural access, and I know Granville County, we're not that far from Durham or Raleigh, but it almost is like night and day. And a lot of folks in our community, can't go to Duke My Chart. They can't, go to the state website because they literally don't have internet access. So I just wanted to provide that feedback to you.
Cornell?
If I could get off mute, it'd be a whole lot easier, right? Thank you so much. Yeah, that is the struggle we actually fight every day. We understand there's a huge segment of the population that do not have reliable internet access or internet access at all. So we've been doing some digital type of information sharing, but also, like you were saying, using the phones. When I was in college, I used to be a club promoter, a party promoter. And so we used to, when I started way back in 1997 as a freshman at North Carolina Central University, we used to do a thing called handbills, where we would just, promote parties through giving out flyers. So I was telling people, I said, we got to take it old school and start putting this stuff on paper, printing it out, and then, being able to, get it in the hands of grocery stores that people, as they're ordering groceries or picking up groceries actually physically in the store or getting it ordered sent to their house, having that information be able to be placed in those grocery bags so people can find out what's going on. And so we just secured some partnerships with some stores across the state to actually do that. And I know one of those type of entities was like a Dollar General or a dollar store or somewhere like that, where there are a lot of people across North Carolina, which is 80% rural. You see those type of stores across the state, more so than you may see like a Food Lion, a Harris Teeter, or other like bigger chain grocery store. But you'll always see one of those dollar type stores in our communities. And so what better way to reach our people than getting the information that we need to reach them through the ways and methods that are not as contemporary, but still are effective.
And we all know we all go to the dollar store, that's for sure. So that's a real good move. Brooks, have you say you have gotten your vaccination?
I have. I got my first one on Tuesday.
And what was that experience like? Because you're in Hawaii, so
I am, yeah.
are the rules a little different there than they are everywhere else?
I guess I haven't really paid very much attention to what they are anyplace else, but I'm an employee of the University of Hawaii, and so that bumped me up the list quite a lot more than I expect. I didn't expect to get a shot until summer, and because I'm not a teacher, I'm staff, just a guy with a job. I'm not really in front of students, but the whole university, they wanted to get inoculated as fast as possible. So they bumped us up, and we got an email that said, go today and sign up, basically. You know, it's like you have now. And so I went and signed up, and a week later, went to a hospital on the other side of the island, and it was, the process there was seamless. And like you said, the person who gave the injection was great, funny, engaging with people. These people work so hard, it's unbelievable. But heroes, really. And but it was seamless, and I had no pain. I had a little bit of soreness, but I felt really tired the next day and the day after. But I always, when I get my flu shot, and I get my flu shot every year, I always react to that. 2 days later, I feel crappy for 2 days. So I expected to feel junk, and I kind of did, but not as bad as I thought I would. So.
And you were anxious to get the shot?
Very.
All right, Gary, let me ask you. You and your wife have gotten the shot, the first dose?
Yes, we have.
And so what was your experience like? Did you actually go to a physician, or did you go to your corner drugstore?
No, actually, we had two of the health systems in the Philadelphia area, Mercy Health and University of Pennsylvania. They did a collaboration, and they managed to get the information out to people. Actually, a friend and colleague of mine, had sent me a text message with a link to connect with them, and I filled out and connected to the link and answered all the questions that they wanted us, but we both answered all the questions they wanted us to do. And then they gave us an appointment like for the next weekend. So it was like really 7 days after we applied, we were able to get in and get the shot. The entire experience, honestly, for the first shot it went pretty well. There was no major problems. My wife and I, we both had some arm soreness, and it really was sore the first maybe day and a half. Maybe about the end of the second day, it wasn't as sore. But by the time that we got to the third day, it was almost as if we hadn't taken the shot. So the doctors that were giving the shot at the place, they were nice. They were, they answered your questions or any questions that people had, and the entire experience probably took maybe less than about an hour, maybe about a half hour to go through the initial stuff we had to do, get the shot, and then they suggested that you wait for about 30 minutes afterwards, and then we left.
So does anyone, first of all, have any question for Cornell before I ask him a couple of questions? Anyone have a question?
I do. Do you have I guess, can you request the one that you want? Like I know Dorothea just said that she would prefer the Johnson & Johnson because it's a one shot, or is it whatever they have available is what you're going to get?
Yeah, and that's what I was just about to say. It depends on your situation and where you go. So some places, a lot of the health systems, such as like an Atrium or Novant or Duke or Chapel Hill, in a lot of those cases, a lot of them have the Pfizer because they're able to store the colder temperatures. A lot of your local health departments and other providers can have a mixture of Pfizer or Moderna, depending on just what they can store and keep it the temperature that's needed for each vaccine. And that's one of the beautiful pieces of having the third vaccine from Janssen or Johnson and Johnson be connected, because the shelf life is longer and the temperature needed, as opposed to the Pfizer, is not as rigorous. It's just really like a normal kind of temperature you would do with your normal flu vaccine, very similar to how Moderna is. And so my wife recently got her shot, not yesterday, but the Friday before. And she went to the Friday Center over at UNC. And when she was setting up her appointment, she did ask about what vaccine that they had, and they said a lot of times they just don't know what they're getting until they get it, and so it might not be until that day, right before you get your shot. Like when you're getting there and pretty much signing in, then they can tell you, which one you're getting. But I have heard of some instances where medical professionals have told patients to have a preference based on some of their medical situations, to get one over the other, just to be safe. Not that there's any really in-depth research that has always surfaced to show a certain difference between one or the others, but just as you were saying earlier, to be on the safe side, having that consultation with your medical doctor or physician or medical team to just say, hey, these are my situations, these are my interest points, and these may be some of my questions. And it's never a bad idea to ask questions.
Thank
Okay,
you.
anyone else have any other questions? So let me ask you this, Cornell. What misconceptions do you just want to put to rest once and for all?
Well, there's a few, right? So people are getting hung up on efficacy and efficiency, which are two different conversations. But when we're looking at, and somebody mentioned the flu shot, when you're looking at the efficacy and effectiveness of the flu shot, the people who make the flu shot have come out and even said, if we could get something as efficacious or effective as what we're seeing in any of the vaccines, they would be through the roof. And so you're looking at percentages and its variance of the flu shot being around like 40 something percent effective, as opposed to the vaccines being between 60 and like 95% effective when administered. And so there's a huge difference. And it's because of all of the newer interventions that have been connected to these vaccines, as opposed to the flu shot does a different technique. And so that's one thing. The other thing is pulling a lot of people's hair out, is this incomplete narrative of hesitancy in African American communities that are in other communities, but it seemed like there's been a very huge spotlight and highlight of this incomplete narrative of hesitancy for our people. Now, we understand that a lot of it is warranted based on the history we've seen in medical experimentation with people of color. You got Tuskegee, you got Henrietta Lacks. You have eugenics in this state, and you have similar stories in other states and other places around the world. You've got the radiation studies that happened at the University of Cincinnati. There's so many. You have the gynecological studies that were done on women of color throughout history. And so there's so many negative pieces that we could point to and say, we don't want that to happen again. That's what's so important, to make sure you have components like IRB or the Internal Review Board that have been put in place to protect human subjects against research. So when we start hearing about this hesitancy in Black and brown communities, it's not that these things never existed. It's a lot of times people saying, I don't want to be first. And that's what we saw with this vaccine, is a lot of people just didn't want to be first. They were curious, they had questions. And I think that's healthy, especially when we're having informed conversations that people can make informed decisions. And so now, there's still people or organizations pushing this hesitancy narrative. And until we get an overabundance of supply, we still have people that are Black and brown from groups 1 through 4 now that are on a waiting list. And until we can get all the people who want vaccine off waiting lists, I think the narrative of hesitancy is an incomplete narrative, because it doesn't really paint the proper picture. And then we've already heard stories on local levels where people in powers or roles and influences, like county commissioners, have said to community leaders of color, and I quote, I heard you people don't even want the vaccine. So why are you out here? Yeah, I saw your face. They said that exact phrase to us. They said, I heard your people don't even want vaccines. So why are you out here fighting for them to get vaccine? And it's just such an incomplete narrative, and people are taking it and running with it in a way that is unhealthy, because it's preventing a lot of people who do want vaccine from these various communities and walks of life to really be engaged and get the care that they want and need.
Well, I think one of the major issues I had in the very beginning is that they called it Operation Warp Speed, and all of a sudden in less than 3 months we had a vaccine. And I was like, wow, we can't even find a cure. We've been paying all this money and donating all this money for cures for cancer and all these other things. And,
Right.
and so that bothered me, in the sense that, would it really be safe and effective if they could produce it that quickly? Did anybody else feel that way?
I felt that way too, but one thing that we have to put in mind on that, it could be me too, but the treatment for cancer is way more profitable than when folks are just coming out of here with COVID. People are just dropping dead on COVID. So I would think that they would make more effort to get that under control. Cancer, all that is more money in the actual treatment of cancer than it is to cure cancer. So that's that's my thought process on that.
One of the things that did not come out early was that they had actually been researching COVID as a genus for like 20 years. Okay, COVID is not new. COVID-19 is new. And people have to remember, there's a reason it's called 19. It's not the first one, okay? And so they were able to take that existing research and apply it to this new variant, which actually got out of a lab, and it got out of a lab and got transmitted to humans because they used CRISPR to alter the genetic structure of the lungs in the lab rats so that they were human-like. And so when the disease learned to latch on to human-like lungs, and they had a shortage of qualified personnel in the lab, it got out and it got into humans because now it had mutated where it could get into humans. But they were able to take existing research, build on it very quickly, and move forward. So it's not a 3-month vaccine, which, mainstream media has been horrible the last 6 years. And actually it was creeping up before then. And you have to really honestly read news sources that are not US based. ProPublica, The Guardian, BBC, they're all publishing detailed research on this virus that is not being covered in the United States of America. The US has clickbait headlines, and that's what they want to promote because that's what makes them money. But real in-depth articles about what they've been doing are out there. They're just not from US media.
Interesting. Okay, you dropped some knowledge that I wasn't even aware of, and I'd like to think I'm informed. But okay, so let me ask this, Cornell. It's time just winding down here. How long should we be wearing our masks? And I'm going to ask another question on top of that, because here's the thing: now that people are getting vaccinated, we don't know who's really been vaccinated and who hasn't. So
Right.
people, that people didn't even want to wear the masks when we didn't have a vaccine. So now they can use that as an excuse to say, well, you know what, I've been vaccinated, but I don't know that you've been vaccinated. So how long should we be wearing masks, and how do we handle that whole thing?
So to be on the safe side, I have cautioned people to continue to practice the preventive strategies of wearing masks, waiting 6 feet or more, and washing your hands and surfaces, and not gathering with people that you don't know are vaccinated or not. So until the guidance comes from, the top, and when I say the top in North Carolina, we're thinking about like Dr. Mandy Cohen, who's, Secretary of Health and Human Services, or the governor. Until those kind of restrictions or guidances are put in place to get back to not doing those preventive strategies, I say keep doing them just in case, because you just never know, like you were saying, who is vaccinated or not just by looking at them. It's just, this is a crude way of making an analogy, but you can't always tell someone who's got an STD or STI, just by looking at them. But you want to have that layer of protection to make sure that, one, you're not getting infected, and two, that you're not spreading infection. And so good ways of doing that are keep wearing our mask, and in a lot of cases, people are even double masking to further protect themselves. And one thing that somebody said earlier that is an interesting point is that somebody said something about getting back to business as usual, in a sense. And one of the things we've done here in North Carolina is stand up a work group called the Historically Marginalized Population Work Group. It's got 6 work streams: prevention, testing, contact tracing, case investigation, wraparound services, which include isolation and quarantine supports, behavioral health, and procurement, which we've just renamed as economic opportunity and equity. And so through those work streams, we want to make sure that we don't go back to business as usual, because that didn't work for a lot of Black and brown people and people from historically marginalized populations, in terms of the aspects of not being resourced properly, or being able to take advantage of opportunities that weren't always presented in our communities. And so in that aspect, we want to make sure, as we move towards recovery from COVID, that we are improving our health, well-being, and opportunities to really achieve equity, in the sense that all people can have the opportunity of good health and well-being as we move forward past this pandemic, because business as usual has been killing us for years.
Yeah, it has. All right, so I'm going to ask everyone. Yes, go ahead, Dorothea.
I don't intend to put my mask away at all. when I'm in a large, like the grocery store and thing, I'm not ever going to put my mask away anymore. I'm just not. And that's just because I had planned to start wearing a mask during the winter anyway because of the flu. And so COVID has just shown me, you don't know what's going on in large groups. You need to go ahead and take care of yourself. So anytime I'm at the grocery store or any large place, Sam's Club like that, I'm going to be wearing my mask.
You feel that way, Gary?
Actually, I do. I mean, I agree with Dorothea. I mean, I think that because we don't really understand, we don't really know what the long-term implications of COVID-19 are, and the vaccinations, and how that's all going to work out for us. I don't know if I plan on wearing it forever, but I mean, to be honest with you, I mean, I'm very cautious about it. And even when we begin to return to some sense of normalcy where we can, you know, have outdoor barbecues and et cetera, I mean, there is still there's that thought, that fear. So yeah, it's going to be a little while. I mean, before I don't wear a mask, because I think we want to see. I think what we want to do. I think we want to see the numbers go down, consistently continue to go down. I mean, to like a really like low number where we can feel safe. But I mean, but I think the other thing is that some of the practices that we've learned to do under COVID are the things that we're going to continue to do. The frequent washing of our hands. I mean, I was washing my hands before that, but I'm really washing my hands now. And you know, I've told all of my family and my friends, please do not take this personally. But if you don't get a handshake or a hug, if you get a fist bump or something, it's not personal. You know, so I think if nothing else, I think it's going to change the way we definitely interact with people. And so yeah, I'm with the I think that it's going to take a while for me to get back to that, if I get back to that.
Yeah. How about you, Brooks?
Well, in Honolulu, I mean, our sort of base culture is very influenced by East Asian cultures, and you know there are a lot of people in Hawaii from Japan and China, and you would in the before times you'd see people wearing masks all the time. You know, in Japan and China, if somebody has the flu, or somebody has the cold, or somebody thinks they might have the flu or the cold, they wear a mask to protect other people. And so it was not uncommon. Not everybody did it. I didn't. Most people didn't, but it was a normal thing to see somebody in a mask. It was not unusual at all. And so I think I can easily see other friends of mine and I've talked about carrying that aspect forward of, oh, I feel a little, you know, sniffly today. I'll wear a mask, you know. Malama kiake keaka. Take care of each other, you know. So I think that'll continue. I think I've been, you know, giving people the Vulcan hands when I am greeting. So I plan on keeping to do that. So yeah, it's, you know, the little things. There's been no flu this year, apparently, because of, you know, the hand washing, the people wearing the masks, all that. So I think that it would be a good idea to continue some of these things.
Just trying to understand, how come we have to have people in authority to tell us to wash our hands? I can't really understand that, and I've never understood that. So that's just me. Daryl, are you down for the mask indefinitely, or are you going to ease up at some point?
Beverly, I'll just say, keep your bail money handy. I about got in a scuffle at the post office just this morning. I had my mask on. This lady that I've known for a very long time from right here in little old Creedmoor looked at me sideways because I had my mask on, and I simply said, "Can I help you?" And she said, "Why are you wearing that mask?" And I said, "Why aren't you wearing your mask?" And it went downhill from there. So again, I simply say, keep your bail money handy, because I'm joking in a way.
I know.
But no, I
would come to your rescue.
it's like Ms. Kemp said, you know, at the very top, you know, I'm going to be wearing my mask for the foreseeable future, because it's what I think what we need to be doing. Absolutely.
Bev, he's not joking. Keep that bail money open. I live in Durham. I'm not that far from you, so I got your back.
Thank you, sir.
We
I
all got
appreciate
your
it.
back. That's right. We all
I've got Vimo, so I'm good.
So Vicki, what about you? Let me ask you, are you going to wear your mask indefinitely? And when do you see yourself actually venturing out into the public? I mean, in gatherings where there's a lot of people.
Well, I haven't, the only times I've been indoors with a lot of people are hospitals. I had surgery in September, I had a concussion in December, and then I had my vaccine last week. And I'll tell you, my blood pressure really went up in those indoor settings with a lot of people. Even though everybody was wearing a mask, it still made me nervous to be indoors with a lot of people. If I go to grocery stores, it's during senior hours, and I'm in and out, you know. My impulse shopping has plummeted in the last year because I'm not wandering up and down the aisles. Oh, what's this? What's this? I get what I want and I leave. So I've been to one outdoor event. Our neighbors, it was very socially distanced. It was actually a one-woman show about Fannie Lou Hamer, and it was great. But other than that, outdoor stuff has been going for a walk or hanging out with our neighbors. They don't all wear masks. My husband and I always wear masks. We're also the only ones on our block who have been vaccinated, and likely to be the only ones for a couple months because we're the oldest ones on the block. As far as beyond that, I actually booked Amtrak tickets to go to New York in May. And I have a roomette, so I can eat my meals in my room. And the only person I really come in contact with on the train is the attendant, like 2 or 3 times during the trip to New York. And I'm working on another book, and part of it involves people grieving their friends during COVID. And I know a lot of people in New York. It's been a year since I've been anywhere outside of Chicago, and I'm anxious to see them, but I don't know if I'll go to indoor museums. I don't know yet there are some indoor theater performances will be happening. I don't know if I'll go. I don't know if I'll eat indoors even. I don't know how comfortable I will feel 2 months from now. I know right now I wouldn't do it. But I sort of take this a day at a time. I feel differently now than I did 2 months ago about where I would go. And I would not consider traveling anywhere without being fully vaccinated. So that, I think that, in 2 months, a lot more people will be vaccinated. Not everybody will be. And you're right, you can't tell by looking at someone. But I'll keep wearing the mask, until Dr. Fauci says you don't need to wear a mask anymore. And I don't think he's going to be saying that anytime soon. So, I'm okay with it, The only thing I'm hoping for in my trip is to be able to hug my friends, but we'll see.
All right, Tasha, how about you? Are you going to wear your mask indefinitely as well, or at some point are you going to just feel that it's okay?
Maybe at some point, but right now I don't even see. I'll be wearing my mask. I was going to ask that question about the flu. Someone actually addressed it. I haven't heard anything about the flu, and it's because we've been wearing our masks and washing our hands. Like I've always washed my hands, and I'm like with you, Bev. I'm like, I don't understand that. We should have been doing that, but yeah. But I will be wearing my mask. And as far as traveling, and being comfortable, I was supposed to be going home to St. Croix last year, and we had to push the flight out. And of course, I lost my aunt, and I wasn't going to go home for that service. I just didn't feel comfortable with the mask or being tested or any of that. I just wanted to stay where I'm at the house. So, but yeah, I will definitely be wearing my mask.
All right, and we're going to give the final word as we conclude this particular call to you, Cornell. So, you want to wrap it up with any closing thoughts?
Yeah, and I think we've heard a lot of good conversation. We've heard a lot of trepidation of even being social. And that's something as we come into, my boss, Mr. Ben Money, likes to say, we're at the beginning of the end of the response and moving into the recovery period with this vaccine being available to people, and that virus we're trying to get to this thing called herd immunity, where a certain number of the population has been vaccinated so that we can, in a sense, and not to sound violent, choke out the virus, that it doesn't spread anymore. So by getting the vaccinations open to larger segments of the population, especially in those communities that need it the most and are the most vulnerable, it's important that we can get people vaccinated so we can reach that herd immunity, choke out this virus so that it just kind of implodes within itself, and that we continue to save lives. And so as we're thinking about that recovery period, there are a lot of pieces that emotionally and behaviorally we have to be cognizant of as we move forward. And so I often say to people, make sure you have outlets, make sure you have people to talk to, or things to also keep you active, because we don't want to get into a sense where we feel that we're alone and nobody can be connected to us, or and I know that this pandemic has done that to a lot of people. So I'll stop there, because I could literally talk to you, Bev, as you know, over and over again. I just love your energy. I love your activism. And I love the spaces that you create for other people to have conversations that are meaningful and needed in our communities across the world. And so I thank you for being able to bring us all together. I thank you for being a pioneer in the aspects of information and sharing. And I also just thank you for being an amazing human being in the way that we need to see more of that in our lives and mirror your leadership. So thank you, and thank you all for being on this panel. Learned a lot, and we'll take a lot of what I'm hearing and share it with our leadership so we can still continue to make informed decisions for communities.
Wow,
So
talk about giving you your flowers when you're alive. Yes, I received that. Thank you so very much. And I want to thank all of you who, some of you, well, Brooks, you've been with me since the beginning almost, and Vicki and Gary and Dorothea. Tasha, thank you for participating. And Mayor Moss, we got your back. Don't forget that. We got your back. Okay. All right. So that is really going to do it for this edition of Racism in America. Get your vaccine. Let's get back to not business as usual, but let's try to get back to some sense of normalcy. So thank you so much for tuning in. Take care. Bye.
Aloha.
Good news.